On the line with us is Carl Higbie, conservative, Trump supporter, founder and president of the George Washington Leadership Foundation, former Navy SEAL and author of Enemies, Foreign and Domestic, a SEAL's Story. His website is gwleadershipfoundation.com, and you can tweet him at Carl Higbie, Carl with a C, Higbie, Higbie. Carl, welcome back to the program.
Thanks for having me on again, Tom.
Thanks for joining us. I'm trying to figure this out. Donald Trump, when he was campaigning, and in fact, we have a, I can't play right now, but we've got a mashup around here someplace of the 8 or 10 times on the campaign trail that Donald Trump said, I'm not going to touch, and I'm not going to allow the Republicans to touch, because they constantly want to do this. In fact, repeatedly, he said, you know, Republicans want to destroy your Social Security, Medicare, and Medicaid. I'm not going to let it happen. And now we're hearing that, oh, gee, you know, we need to, well, Paul Ryan's already planning it. I mean, he's already got the legislation half cooked to cut Social Security benefits substantially, to cut Medicare by as much as half, to cut Medicaid substantially, and of course, to repeal Obamacare and replace it with we have no idea. So what is the Republican plan for health care, both for people over 65, in other words, Medicare, and for people under 65?
Well, I think you pay on Medicare your whole life, so I believe that we do have to honor that in the capacity that they.
Carl, if I can, it sounds like you've got your thumb over the microphone or something. I can hardly understand what you're saying.
Is it better?
No, are you on a cell phone or a wireless phone?
Yeah, I'm on a cordless.
Ah, okay. Geez. Yeah, okay, try it, but maybe you can walk closer to your source or something, because it just sounds terrible. If we can't clean this up, I'm going to have Chris call you back. He should have checked this out when he was listening, when he first put you on the line, unless it's deteriorated since then. So start over again, please, because I could only understand about every other word.
So I think that we have an obligation as a society to repay that Medicare that's been paid into by people their entire lives. I mean, 65 years people pay, or let's say in the better part of their workforce time they pay into it. So we have to pay that. And the thing is Trump doesn't control what the legislature puts forward. He has some say in vetoing and things like that. But
and he's got the bully pulpit to sell things or kill things.
Exactly, but he can't. They're allowed to vote on whatever they want in Congress. So until Trump comes out and really supports Paul Ryan's bill that he's proposed, I don't see where it's on Trump's lap.
Yeah. Okay. So you think Donald Trump is going to block the efforts of Paul Ryan and Mitch McConnell to gut Social Security, Medicare, and Medicaid, and well, actually that question first, and then the second question is, Trump himself has already said he's going to repeal Obamacare. What the heck is he going to replace it with?
Well, I mean, look, I was a Navy SEAL, and I'm, on the defense side. So if you
so you had socialized medicine, and you probably still do if you're using the veterans benefits that you have.
No, I don't use the veterans benefits I have. I don't believe in socialized medicine. I think it would be nice in a perfect world for everybody to have health care. But
so you think the Veterans Administration the VA hospital should all be shut down?
Yeah.
Okay. All right. Well, at least you're upfront about it. What do you think should talk to me as if I'm somebody who is working 3 jobs and making an aggregate of, say, $30,000 a year, because they're all, $11 an hour jobs. I'm working at McDonald's, I'm working at Walmart, and I'm working part-time at a gas station or something. And I got a couple of kids, and I can barely pay the rent. And, what is it that President Trump is going to offer me as a replacement for the Medicaid that I'm on right now? I mean, this is, in fact, as you know, Walmart and some of these other organizations, some of these other low-wage employers actually inform their employees, in many cases, how to get on government benefits, because that's part of their business model. So where am I going to get my health care from, if I'm making $20,000, $30,000 a year, can barely pay my rent? Where, how? What is Donald Trump going to offer me?
Well, here's the thing: is health care a right? Absolutely not. Is it owed to everybody? Absolutely not. Would it be nice if everybody had it? Yes. So what I say to that person is, if you can't afford certain things, you don't get them. It sounds harsh, but I don't think that the society should be forced to pay. I mean, look, when we passed Obamacare, everyone's premiums went up. and more people can't afford them. The only reason they're doing it is because they're getting fined if they don't.
Everyone's premiums have been going up ever since basically Reagan deregulated the healthcare industry and made it possible for states or made it impossible basically for states to require health insurance companies and hospitals in those states to be not-for-profit as they used to be. But, setting that aside, so I get it. So what you're saying to me as a person working 3 jobs with a couple of kids and barely getting by is, Thom, if you get sick, die quick, because that's the Republican healthcare plan. Alan Grayson was right.
No, that's not what we're saying. No, we're not saying die quick. We're saying that
you're saying don't get sick. He said the Republicans have a 2-part health care plan. Number 1, don't get sick. Number 2, if you do, die quickly.
Well, he's not a Republican, so the issue is we're not asking people to die quick.
Okay, I'm that guy making $30,000 a year because I'm working 3 jobs, 3 minimum wage jobs or slightly above, and I'm working 90 hours a week, and I've just discovered that I've got colon cancer, and it's going to cost me at least $100,000 to have surgery to save my life, and I've got no health insurance. What should I do, Carl?
Well, I would ask, how do you pay for it? Does it come?
I don't have any money to pay for it. What should I do?
No, how does society pay? It's not my job to pay for Joe Schmo's health care. It's not society's job to take care of Joe Schmo.
Don't you think that's a sociopathic perspective? What if we said that about fire departments? It's not society's job to put out the fire in your house.
Well, actually, yeah, if you pay taxes into the town system that employs the fire department, then yeah, absolutely.
Yeah, absolutely what?
Absolutely, it is the town's job to come when you call them.
Okay, so if we pay taxes into a single-payer healthcare system, which, by the way, would cost us half as much as what we're paying right now through the for-profit health insurance companies, if the experience of every other developed country in the world is any indication, then we all should have health care, right?
Not really. How do you – look at the price of health care has gone up substantially to the individual. How do you propose to pay for this? This is the problem.
Get rid of the health insurance companies. They're just banksters.
Okay, so the health insurance companies that were forced into this, like Aetna, that left Connecticut and left 6,500 jobs out on the table. So a lot of those 6,500 jobs are now Joe Schmo making $30,000 a year. And
right.
So you would say to him that because of Obamacare, Aetna jumped out of the exchange. They jumped out of the state of Connecticut. They closed down that.
No, hang on just a second, Carl. Let's just correct the record here. Anybody can Google this just simply by putting Marco Rubio and risk corridors and New York Times into a Google search. About a year ago, Marco Rubio led a group of Republicans in the Senate to insert a rider into the annual budget bill, which was passed and signed into law. And that rider did away with the so-called risk corridors. And the Republicans knew, nobody even knows what the hell a risk corridor is. Nobody's going to notice this. But when Obamacare was put together, everybody understood, and the insurance companies laid this out, that the insurance companies, at least during the first 5 or 6 years of Obamacare, probably a little longer than that, were going to, in many years, actually lose money because people were coming on who were sick. They could no longer exclude people with pre-existing conditions. So at the end of the year, the insurance companies would add up how much they lost. They would go to the federal government and they say, okay, Aetna would say, hey, this year we lost $500 million. So the federal government would literally write them a check for $500 million. That money was appropriated. That money was set aside. That money was paid for. It was part of Obamacare. And those payments are called the risk corridors for the health insurance companies. Once those are gone, the health insurance companies have 2 choices. They can stop providing health care, which they'd really rather not do because that's how they make their living, or they can jack their prices up. If they happen to be in a state where you've got an insurance commissioner who says, no, you can't jack your price up 40%, you can only have 10%, then they leave that state. But it's the elimination of those risk corridors. Rubio did this back, early in 2016, knowing that it was going to take effect in October, 6 weeks before the election. And just on time, 6 weeks before the election, we all got these notices that the insurance companies were raising our rates. That was intentional sabotage by Republicans. That has nothing to do with how it works. But, if you're saying that you don't think that we should have a healthcare system that's run by banksters who have nothing to do with healthcare, the guys who run these health insurance companies, the multimillionaires, 100 multimillionaires, billionaires like Stephen J. Hemsley, who run companies like United Healthcare, never give a vaccine, never look in a kid's throat for strep throat, never do any of that. They're banksters. They handle money. If we eliminated them, we'd save an enormous amount of money. But you're saying, if you're saying you want to get rid of them, I'm all in favor of that. But what are you going to, it sounds like your replacement for it is good luck, Charlie, right?
Well, now that was a nice 2-minute and 30-second monologue there, but
and thank you for letting me do it.
When you brought me on, I was a Trump supporter, not a Rubio supporter, right? Never supported Rubio, supported Trump from day one. So I didn't support Rubio's plan because he did crap like that. So what I like about Donald Trump, he's a businessman. You find out what makes sense on paper, and what doesn't make sense right now is having the majority of Americans who are healthy pay for the majority of the Americans, or all the Americans who are unhealthy, who are now getting essentially free health care because they're subsidized while everybody else's premiums go up. My premiums go up, and I can tell you right now, I have a number of friends who are doctors, nurses, and working in the emergency department, and these guys go in there that are on these Medicaid and not so much Medicare, but it's more the younger Medicaid. They go in there, they claim chest pains and trouble breathing. They go into the doctor's office. Turns out all they have is a headache and they need a Tylenol. So they've wasted everyone's time. They've wasted everyone's money for that visit, and they don't end up.
Carl, I'm not believing it. I'm not believing that anybody. There's a very small percentage of mentally ill people who have hypochondria, basically, who may be overusing healthcare services. They get identified fairly quickly. I have a couple of healthcare professionals in my family who work in hospitals, and those folks, along with drug-seeking behaviors, are very quickly identified and very quickly basically weeded out or dealt with. That is not an issue here. The issue is how are we going to make sure that if somebody's body catches on fire, just like their house catches on fire, that we can put that fire out. If somebody gets cancer, somebody has heart disease, if somebody, and it sounds to me like your answer is, call your rich uncle.
So is it everyone's job? Do you believe that healthcare is a right?
Yes, I do.
Or do you believe food is a right?
Yes, I do. I believe these are the basic tenets of civilization. And as a Christian, I believe that they're also the basic tenets of Christianity.
Where is that written into the Constitution?
In the Constitution, it's called general welfare. It's in the preamble. It's in the beginning of Article 1, Section 9, and it's at the end of Article 1, Section 9.
Oh, so you're inferring that is in there, but it's not actually in there.
Well, I would refer you to George Washington, who signed the first piece of legislation to provide for the health care for poor people here in Washington, D.C. He was our first president, and he was the first person to do that. So it's a long American tradition, Carl. And he was one of the founders. He knew what was going on. So if you're trying to say, oh, the founders didn't want us to have health care, you're wrong.
Okay, well, but then you just said, though, that you're inferring that. There's no actual factual evidence.
No, I didn't say I was inferring it. You said I was inferring it.
Well, you said yes. So the issue is...
That's not an inference. It's a statement.
In your mind, you can infer that it's everyone's societal responsibility to pay for the few who can't or won't pay for it. I know plenty of people who have the money.
For the few who can't, you got 47% of America right now living at or below the poverty line.
In large part due to the fact that Obama had shoved...
In large part due to 40 years of Reaganomics and stupid trade policies, but that's a whole separate debate. I mean, this was not so much the case 40 years ago before Reagan. But Carl... if you're going to say that the 47% of Americans, to use Mitt Romney's number, he was actually right on that number. 47% earn so little that they pay no federal income taxes, that they should just go to hell, just go die. Is that what you're saying?
I'm saying there's a lot of people out there that need health care. A lot of people out there who have
half of America.
So here's the thing: I don't want to pay for someone else's health care.
Okay, I get it. Carl Higbie, Mr. Selfish. I get it. Okay. Carl Higbie, former Navy SEAL, he's the author of the book Enemies, Foreign and Domestic, A SEAL's Story. His website, GW Leadership Foundation. He's the founder and president of the George Washington Leadership Foundation. You can tweet him at Carl, C-A-R-L, Higbie, H-I-G-B-I-E. Carl, thanks for being with us.
Thanks, Tom.